There are more than 22,000 active cases in the province now. Our positivity rate is sitting at 9.6%. There are 647 Albertans in hospitals with COVID-19 right now. And we talk a lot about capacity in our healthcare system, but this is what it looks like right now. Of those that are in hospital, 186 of them are in intensive care. These 186 Albertans are critically ill with COVID-19, and that's a record high for the pandemic in Alberta. Many of these are people who are sedated because they're on respirators, unable to breathe on their own, and who cannot have any human contact except through layers of PPE. Of course, throughout this whole time, Albertans have continued to suffer strokes, heart attacks, serious accidents, and sudden health issues that also require admittance to intensive care. Currently, added to the 186 COVID patients in ICUs are about 55 more people who are in ICUs for non-COVID-19 reasons, but who are also fighting for their lives. So that's a total of 241 people in intensive care, when normally our healthcare system is set up to care for about 170 people in ICU. So we are about over 40% above our normal maximum capacity and our pre-COVID record high for ICU admissions. That is why we say that the measures we have introduced were necessary, and because we must protect our healthcare system. Combining large numbers of COVID cases in hospital and ICU, with everyone else who also needs care, puts everyone who needs healthcare in jeopardy. And when AHS takes steps to free up capacity, that means that thousands of people who need surgery are told to wait. Eventually, if we did not take action, we would have to start looking at canceling even thousands more surgeries and triaging more patients. That means denying some people care, making a difficult decision on who gets intensive care, for example. There's also been a belief that COVID-19 is a big city problem and not a rural one. But this couldn't be further from the truth. Throughout the pandemic, people living in rural areas of the province have been more likely to be hospitalized with COVID-19 than people living in large urban areas. Since February of this year, hospitalization rates are 26% higher, and ICU rates are 30% higher in rural areas than in urban ones. Right now, several of the regions that are showing the highest rates of COVID-19 per capita are outside the bigger cities. Some of these areas are reporting rates higher than Calgary, and in some cases, rates that are 2 times higher than Edmonton. So the point here is no one's to blame for COVID, and no region is. The point is simply this is not an urban versus rural issue. It's clear that COVID-19 is everywhere in the province, and people's lives matter just as much no matter where they live, where they come from. The people that are getting ill and hospitalized now are overall younger and without compromising health conditions, because we took steps to protect the most vulnerable and elderly Albertans first. And we are now getting steady supply for vaccines. We've just made sure that everyone who wants a vaccine can get it as quickly as possible. 2.2 million doses have now been administered, meaning 49% of Albertans 12 and of the age of 12 and older have now received at least 1 dose. We may cross the 50% threshold later today or tomorrow. Soon, you'll be able to look up the percentage of individuals who have received at least 1 dose, the percentage of people fully immunized, and the total doses that have been administered in your area by age group. Make the choice to get protected. The sooner you are, the sooner we can lift restrictions and get back to normal. So here is some really good news. Albertans have stepped up to the plate in the last couple of weeks in a big way. Thanks to the efforts and sacrifices made by millions of Albertans, we now see case numbers coming down quickly in almost all parts of the province. We do expect to see hospitalizations peak in the next week or two because of the time lag effect between infection and hospitalization. But with declining COVID numbers, we can look forward to easing restrictions in the fairly near future. We are working on a clear path to reopen Alberta this summer, tied in part to the rate of vaccination as well as to hospitalizations.